Hi, Paige Hollingsworth here, and I'm presenting on play therapy. According to the Association for Play Therapy website, it is the systematic use of a theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth and development. Play is strategically used to help children express what's troubling them when they do not have the verbal language to express their thoughts and feelings. Children in general already struggle with expressing themselves because they're still developing these skills, and this is especially true for children who have experienced trauma. On average, play therapy is 5 to 6 months of weekly 30 to 50-minute sessions. Play therapy is a good choice because it provides children distance from their problems, helps them to externalize their problems. It allows for expression of thoughts and feelings at a developmentally appropriate level. A metaphor you could use is that toys are a child's words and play is their language. Play therapy promotes cognitive development as well as healing through the positive experience and relationship with the therapist. It provides insight about and resolution of inner conflicts or dysfunctional thinking in the child. And clients learn more adaptive behaviors such as communication skills, expressing feelings, problem solving skills, and interpersonal skills. Conclusions of meta-analyses of play therapy studies across several years were that play therapy is effective for a variety of problems, populations, treatment settings, and numerous clinical orientations. Play therapy in particular is used with children 3 to 12 years old, but teens and adults have also benefited from play therapy techniques, and in recent years, play therapy has been utilized with infants and toddlers. Research supports effectiveness with children experiencing a wide variety of social, emotional, behavioral, and learning issues. Conditions and concerns that play therapy can help in treating include anger, grief and loss, physical and learning disabilities, behavioral disorders such as ADHD, oppositional defiant disorder, many more. Settings that play therapy is utilized in include schools, hospitals, residential treatment centers, outpatient therapy offices, as well as in-home for therapists who go to the client's home. They might bring items with them that they can use to do play therapy. Materials and supplies for play therapy are carefully selected. They're not just random items they chose. They were chosen for a purpose. There's 3 categories of play therapy materials. First is real life toys, so things like a kitchen set, dolls, play, money, stuff like that. Acting out and aggressive release toys include drums, toy soldiers, handcuffs, rubber knife. Creative expression and emotional release toys include arts and crafts supplies, Play-Doh, chalk, masks, hats, and costumes. That masks, hats, and costumes are for pretend play or fantasy play. Criteria for play therapy items include that they should be generic to allow for more open interpretations. So there shouldn't be any Disney character figurines or anything like that. They need to be interesting, help the child show creativity, facilitate the relationship between the counselor and the child, encourage expression of thoughts and feelings. They need to be able to be used to communicate without words and without rules or traditions. They have to be sturdy and sanitary to hold up to some rough treatment. They need to help gain insight into the child world, provide opportunities for the child to test reality, and provide acceptable means for expressing unacceptable thoughts and feelings. So the play therapy, technique that I want to focus on is the use of clay, in particular Paul White's clay therapy. So it can be used to explore difficult concepts and express fundamental emotions. It is user-friendly for all levels of clinical experience and artistic ability. And the professional guides children in seeking resolution and coping with life issues such as problem solving, self-esteem enhancement, decision making, impulse control, and anger management. So that was all information based on Paul White's clay therapy. And the first link is an article on why Paul White's model of clay therapy is effective for children who've experienced trauma. And then the link at the bottom is a chapter that Paul White wrote for a book on contemporary play therapy. Professional standards of play therapy are established by the Association for Play Therapy. So first and foremost, they should have a master's or doctorate degree in a mental health field with considerable clinical experience and supervision. And then with advanced specialized training, experience, and supervision, mental health professionals can earn credentials from the Association for Play Therapy. So they can become a registered play therapist through that organization. The first link is from the Association for Play Therapy website that gives more information on how to become licensed. And then you can also become a licensed play therapy by attending one of Paul White's 2-day certification courses on play therapy. And then there's a link at the bottom to get more information about his seminars and trainings and things like that. So in order to be culturally sensitive, you should have multicultural toys, dolls, and puppets. And your markers, crayons, and Play-Doh should include multicultural shades. You don't want to use objects that are sacred to a particular group in a profane manner, or what would be considered a profane manner to them. And you want to avoid stereotypes when you select your toys. Some ethical challenges in play therapy include confidentiality, but that's the case, anytime you're working with children, because the, minors aren't protected in the same way that adults are when it comes to confidentiality. And then remaining within your scope of practice is an ethical concern because, you can't be considered a play therapist unless you've earned the credentials required. Although many mental health professionals utilize play therapy techniques. Gift giving can be an ethical challenge because, a lot of times children will draw a picture or make something and then want to give it to you. So you have to establish, guidelines and boundaries for how to address that appropriately. And sexual identity is also a concern. I'll give an example, such as, maybe you're working with a young male child and he wants to dress up as a princess in your session. So as a professional, you're going to remain non-judgmental and you're going to, just let the child be who he is, but, the parents might have a much different opinion on that. So you have to figure out how you're going to handle, those situations. And, you also have to be aware of your own, your own biases or, opinions on things like that. I think seeing a boy, always wanting to dress up as a girl and playing with dolls, most people have, opinions about that, or not most people, but people definitely do have opinions about that. So you have to be aware of anything going on, with that within yourself. So I hope this was helpful and that you all learned a little bit about, play therapy and using clay in play therapy.